Hi, I'm Dr. Gammons. Thank you for visiting the site and for clicking on this video about Vivitrol. This is one of two videos about Vivitrol. Vivitrol is a trade name for a drug called naltrexone. The Vivitrol is a shot. It's therapeutic in the bloodstream for 4 weeks. This video will talk about its use in terms of treating opiate dependence. Now, naltrexone, Vivitrol, is what we call a mu-opioid receptor blocker. It provides complete blockade. It puts a blanket over it. It blocks the receptors that bind opioids. It's been FDA approved for the treatment of opiate dependence for about 3 years. And it's the only treatment option we have for opiate dependence that is not, in fact, an opioid. So, Vivitrol is to be used after opiate detoxification. So whether you're using street drugs like painkillers or heroin, or whether you're using sublingual buprenorphine, most commonly known as Suboxone, these things have to be discontinued prior to using Vivitrol. You have to be in some degree of opiate withdrawal. You can't have opioids actively on board when you receive the Vivitrol injection. If you do, you're going to go into withdrawal. So this is to be used to maintain abstinence from opioids. It's a terrific product. Again, one shot lasts for 4 weeks. The vast majority of insurances cover it. After receiving Vivitrol, it's all about relapse prevention. Again, once the shot's on board, you will not get any benefit from using any opioid, period. You can go back to street drugs. You can want to go back to Suboxone, but if you do, it's not going to bind. The drug cannot bind. Opiates cannot bind to the receptor. The receptor is blocked by this drug. So, again, it becomes about relapse prevention. Every time you hear me talk about addiction, you're going to hear me talk about the importance of behavioral change. Relapse prevention is about challenging yourself to develop new, reliable patterns of thought and behavior. This can be done. It takes a lot of work. The work is well worth it. So for those that are ready, again, this is the cold, hard, honest truth, absolute honesty here. It's not about you get a shot and you're cured from opiate addiction. Opiate addiction is a bad spot to be. Let's just call it what it is. It can be treated. It can be treated effectively. People do get better. It takes a lot of work, and a lot of that work, in my clinical experience, should be aimed at behavioral change. Come in. Let's talk more about Vivitrol. Let's talk more about options that will give you a shot at long-term success and recovery. It'd be my honor and pleasure to see you in the office.